You're listening to Certify It, the podcast for advancing your career in care, powered by the Mason Center for Healthcare Education. Hear news, updates, and discussions from thought leaders in healthcare around advancing your career through continuing education.
Thank you for joining us today for Certify It, the podcast for advancing your career in care. I'm here today with Sue Casey, who is one of our instructors here at the Mason Center for Healthcare Education. And we're going to be talking a little bit today, Sue. I want to talk about your experience being an instructor here, what it's been like over the last year. You've been with us since the beginning.
Two and a half.
So you are going to be able to share a lot of knowledge with us. But tell the audience a little bit about how you got into nursing to begin with.
So I started nursing school when I was 18. I always knew, probably from 9 or 10 years old, I wanted to be a nurse. And back then, there wasn't a whole lot. I say back then because, it was a long time ago. There wasn't a lot of professions for women. It was either teacher or nurse, basically. But I always knew I wanted to be a nurse. So I went to nursing school and I chose a diploma program because I felt like that was the best at the time. And that's what I did. And I was 21 when I graduated. And then I've done many different things. Over the years, I've worked the emergency room. I've worked education as far as staff development coordinator. I was a school nurse for a little while when we lived in Japan. So and I did long-term care for many, many years. And I loved long-term care. And I also loved the rehab part of long-term care and the skilled area.
Okay, well, that's very interesting. So during all of those things that you did as a nurse, and I know that you actually were an assistant director of nursing for us, for Hillcrest.
Yes.
And so was there a defining moment in your career that sparked your interest in combining those two professions that you said you kind of felt limited to, which was nursing and teaching, and you just kind of crammed them together, and here we are. So what was that defining moment that made you think, I would like to actually teach?
So there were two defining moments, actually. There was one when I was a staff development coordinator. I had not started that yet. I was actually doing unit manager. And I had an administrator whose parents were in teaching. And she pulled me into her office and she said, I don't think you're using all of your skills. And I see so much education in you that you could teach so many people. I was doing a lot of in-services just because that was part of my role as unit manager. And she was a fabulous administrator and she put me as SDC and I did a lot of education, a lot of teaching, and I loved it. However, I wasn't sure I still wanted to do that forever. And another job came available that I did end up switching. But then when I was, during COVID, we had to do a lot of education. We had to always be educating people, like even the public, like how many people asked nurses questions. But mostly in our building that I worked at, it was one of our Hillcrest buildings, and there was a lot of education to be done so that people could survive and come to work every day without being scared to death. A lot of education to our patients. So once I was ready to make a change, I decided I wanted to teach CNAs because in the world of COVID, we became shorter staffed at that time. And I felt like if I could reach out to CNAs and reach out to people and teach them, we needed more really good people. And so that's when I came to the Mason Center, and then a lot of our people are just, they want to help people. They want to do things for people. We've had housekeepers come through that see what is going on in healthcare, and they love our little people, and they want to do better by them. So that we've had some housekeepers come through who have been fabulous. And we've had a lot of people that we can train to do this job that it's not just anybody you can train. Not anybody can do this. They have to have a heart for it, and they have to be special people. And the ones that make it to the end of our course and go on are fabulous. They usually are fabulous, fabulous people. And I felt like I could help that in the world, in our little world of Knoxville, to do that.
I think one of the understatements of the year is CNAs are truly the backbone of the organization.
Absolutely.
I mean, we can't do and serve the people that we serve without CNAs. So if there were prospective students that are watching this today, what would you say is one of the biggest misconceptions about the role of a CNA?
That you don't matter and that they're easily replaced. If the doctor doesn't show up one day, that place is going to still run. Our facilities are going to run just fine without the doctor. They will run short-staffed on nurses a lot of times, but you need those CNAs, and those little people depend on them every morning, every night, all night long. They are calling their CNAs, and the CNAs know the patients better than anybody else in the building. And I always tell them, I say, if you ever think you have a job that you're not making a difference and you want to make a difference, a CNA is the job, because you change people's lives every single day.
So what are some of the biggest challenges that your students face during training that you've seen?
Well, if they've never been in healthcare before, and a lot of people are scared, but they still have decided they want to pursue it. It might be a little bit traumatic for them at the beginning because they've not even seen sick people, and these people are people that are older and they're living there, and maybe they don't have family that come every day. And I always tell them, we are making the last part of their life the best part of their life. And if we can do that and make their life fabulous every day and make sure they make it to activities and work as a team with all of our employees, make sure that you get them the food they love, make sure you bring them to activities, make sure you take care of them and do all those things and treat them with so much respect that you can change their life and make it better.
So what I'm hearing from you is if I'm a student in your class, skills are part of the teaching.
Correct.
The bookwork knowledge is part of the teaching.
Yes.
But it sounds like you really interject empathy and compassion in there. How do you do that with a new generation of people?
Well, I probably overtell stories.
I don't think you can ever. Storytelling is the best way for people to learn.
And that's what I do. I tell them a lot of stories that can change people and change little parts of their day every single day. And that's what I do. I tell them, things that have families have said to CNAs before. I've had, where we always teach CNAs, you go to the nurse, you never make a phone call to a family, let the nurse handle that. I said, but there will be families that come in and they don't want to talk to the nurse. They only want to talk to you. And they want to know what the person is doing. And there's always that fine line of, tell them what they need to know, but make sure you let the nurse handle the medical part. But they want to know from the CNA how their mom has done that day. And that they know the CNA has those answers.
You're listening to Certify It, the podcast for advancing your career in care. Brought to you by Propel Insurance. Find innovative insurance solutions in the toughest risk management environments. Over 500 senior care providers nationwide trust Propel to keep their business thriving. Find your momentum with Propel Insurance.
So all teachers have stories of students that stick out in their mind. Some good, some bad, I'm sure. So is there a particular student and a story that you could share with us about?
Yeah. So we had a girl, she was she's a fabulous young girl. She was working, she went to work in housekeeping at one of the Hillcrest buildings, and she decided to come to the CNA class. And she really struggled through the whole class, but it was really hard for her. And she ended up making it, and she still texts me to this day. And she was in one of our earlier classes, and she's very successful. She's still working at one of our buildings, and she loves it. I've had students work with her, and the students loved her. And she'll even text me that night. She'll let me know how they did, and she hoped that she had done well. Was there anything she could do better? And she was just fabulous, and she really had not ever really had a great job. Her mother died when she was young and just had a rough time in her life. And she ended up doing so well, and she's doing so well still. So,
very good. So our students gain a lot of knowledge from you because of just the amount of experience that you have, and as you being a seasoned professional, you bring something to the table that not every student gets to sit under when they come. So what would be one thing that you think sets the classes apart here at the Mason Center for Healthcare Education from maybe any other CNA class that is out there?
Well, because I'm teaching it.
Of course, other than the fact that you're teaching it.
We have a fabulous curriculum, and our curriculum is longer than most. I've met several other instructors. They do clinicals at some of the Hillcrest buildings while I've been there. And I always ask the instructors, they've been at different local places, and their classes are not as long as ours. Our class is much longer. And we offer, like, they can come in extra if they ever need to. We figure things out for them, and we work really hard to make them successful and to help them be successful. And I also think that our clinicals are a little bit longer than others, which I think is really important. If we could even, like, I know the regulations, we have to finish the class, but it's like they always want to hurry up and jump in and get to the clinicals. So I know we can't, but I always let them start skills first, very early on, because when they get into the lab, they're like, oh, this is so much fun. I love doing this. We're going to get to do this with real people, and it makes them feel like they're already progressing. So I think the Mason Center has so much to offer with the way that the program is set up. Just everything about it is fabulous.
So how does the setup at the Mason Center with the hands-on skills lab, the clinical sites that we have available, the length, how does that prepare students for the state exams? What are some of the things that you do specifically as an instructor that maybe adds that little extra to help them prepare for that state exam?
So the little things like when you make a bed, make sure that the sheets are even. Make sure you're doing all that. Make sure you're treating the patient with dignity and respect. And they are so careful during all the skills, saying, I'm going to keep you covered. I'm not going to let you be exposed. I'm going to make sure you're comfortable. And we make that a very big deal. And I will tell them, pretend this is your dad or your grandfather, and he's laying in the bed, and you just come in and pull the covers back. How does that person feel? And different things, and they learn so much. And they really get such good experience with the skills part and with the knowledge, because we have a test every week. But with the skills part, they get so much experience, and then we go into clinicals, and they're attached to a student's hip, a CNA's hip usually. I say stay right attached with them, go with them, watch everything they do, listen to how they talk to the patients. And it's just funny because after all the skills and after everything in class, we're here for 5 weeks, they go in thinking, oh, I think I know how to do this. And they get in and they ask the CNA, they say, when you started clinicals, did you feel like you didn't know anything? And they said, oh, yeah, you're going to feel like every minute you're learning something. And that's what they've all said at the end of and we meet at the end of every class, and we talk about what they did, what was scary, what was good, what can we change. And at the end of the 8 days of clinicals, they have such a good feeling about the test, about getting to work, and they just can't wait to dig their feet in and get to work.
Yeah,
so,
the first part of what you said when you started that was you talked about the way that you even talk to the resident. It reminds me of the conversation I had with Dava Snyder, one of our healthcare partners, when she said one thing that they really appreciated about the Mason Center was we weren't just teaching people how to do the skill. Right. We were teaching them how to act while doing the skill, which is something that caretakers, it's almost a lost art. Anymore.
Yes. Well, and just like when they first come in, and a lot of time, like we have, a list of what they need to do and everything, and they'll come in and all of a sudden they're raising the bed and they're positioning the patient. And I say, hold on a minute. What are you doing? I'm like trying to sleep here, because they haven't explained to the patient. And that will remind them, and they won't ever forget. Like, they have to tell the patient what they're doing every step of the way. And it's that's helpful to them, and it's reading all of the skill parts out loud lets them explain to the patient too what they're doing. And I think that's a huge part of learning the whole aspect of person-centered care.
So with all of the students that you've instructed, there's got to be some common characteristics that you see that makes someone not just a good CNA, but a great one. What are some of those?
I think people that have maybe cared for a loved one over the years. Maybe they lost their grandmother when they were very young, and it was traumatic because they were so young. Maybe they lost their parents. But even if they didn't have a traumatic event, they may have had jobs that they just didn't ever feel important. And they felt like this is where their little niche would be. And I think that, and they are the ones that have really done well and done great things and are fabulous with patients.
So many of the CNAs go on to be LPNs and RNs. A lot of times that CNA role is the starting point of someone's career in healthcare. So how do you encourage that growth?
So I always tell them that, if you choose to be a CNA for the rest of your life, that's fabulous. That's wonderful. However, if you feel a little bit like you want to progress to something else, there's always, the sky's the limit with nursing. You can always do so many things in healthcare in general. And with our students, we have several that have gone on. And I always have my new class when we get to a building that they've gone on and they've started at the Mason Center and then they're an LPN now, and we have several. And I always have them talk to those people because it's wonderful. They give them, the push and the positivity that they need that, you can do this, and when they're like, I didn't think I could ever do that. And I, barely passed CNA class, or I could barely do, and here they are on a med card. And it's good for the students to see that.
Well, thank you so much for spending time with me today and talking about this. One thing before we go that I would like to ask you is if there was one piece of advice that you could give a prospective student that's sitting out there on the fence whether they want to be a CNA or not, they're not real sure, they may be a little nervous. What is that one piece of advice that you would hope sticks with people that choose to pursue a career?
Well, just do it. The sky's the limit in anything you can do. And if you're at a job where you don't feel like you're changing lives every single day, if you don't get up in the morning and love what you do, if you're just like, oh, I'm going to work. Oh, I can't wait for Friday. Oh, I can't. In all the years I've worked, I never, ever felt like that. I loved my job every single day. I loved going to wherever it was that I worked. And I think you always have to feel that passion. And if you want to be a CNA, that's a great place to start. And there is never going to be another job where people need you as much as they need you, or that you feel the gratification that you feel. So just come on and apply and get in here.
All right. Well, thank you so much. We are so blessed to have you as an instructor here at the Mason Center.
Thank you.
And again, thank you so much for giving me some of your time today and sharing with the audience.
My pleasure.
This has been Certify It, the podcast for advancing your career in care. We'll see you next time.
We hope you enjoyed this episode of Certify It by the Mason Center for Healthcare Education. Get connected with us on social media and at themasoncenterknox.com. If you haven't yet, subscribe to this podcast on YouTube and anywhere you get your podcasts. And if you're interested in sponsorship or donations to help further our cause of providing affordable, flexible healthcare certification programs for individuals seeking career mobility in skilled nursing, senior living, and long-term care fields, visit themasoncenterknox.com.